welcome, ladies and gentlemen, to the inaugural episode of the Essential Therapies Podcast with Dr. Cindy. Dr. Cindy is an international expert with over 25 years of experience in myofascial release, therapeutic exercise, and energy work. As a licensed physical therapist, Dr. Cindy has a wealth of knowledge and experience that she will share throughout these weekly episodes. This week is really an introduction to her work and our show, and so we thank you for listening, and we hope you enjoy. Welcome, everybody. This is the first episode of the Essential Therapies Podcast with Dr. Cindy. I'm your host, Brad Augustiniak, here with Dr. Cindy, and we had a whole other script planned for today. I shouldn't say a script. We had a whole plan for today of what she was going to say and a bunch of questions and answers, but things sort of got taken for a loop. What was it, 2 days ago, I think? Right?
2 days ago.
2 days ago. And she got into a little bit of an accident. To say a little bit would be an understatement. But I want you, Cindy, just introduce yourself, tell us all about Essential Therapies, and then kind of go into what happened with your accident and why it's a little bit fortuitous that it happened and relation to what we're doing today. So take it away.
Okay, so I'm Dr. Cindy Hodgson. I'm a physical therapist and an exercise physiologist, and I like to always clarify that because people hear that doctor designation and they automatically think of it as being a physician. And I'm not a physician. I'm a physical therapist. Way back when I took my physical therapy training, it was actually only a bachelor's degree as an entry level. Then they upgraded that to master's, and now you actually need to have what's called a DPT. But that is not how I got my designation. I did a PhD in exercise science. Exercise physiology was my master's degree, and then biomechanics and a minor in anatomy was my doctoral degree. Wow. So that's how I ended up here. I didn't really know what I wanted to do for a while. I actually started out as an accountant, believe it or not. I even worked in the field of back when it was the big 8 accounting firms of Arthur Young, Ernst & Young, and when they merged. And so I'm very familiar with that other type of lifestyle of long hours of sitting and doing audits. And but then it didn't work for me. So I ended up in the exercise science world. So I thought I was going to do a PhD in nutrition. So I have this background of biochemistry, which I truly loved. But when I really got into making that decision, I realized just where the industry was at this point in time was not where I saw myself. I was way more alternative than that, and it wasn't fitting. And so I ended up as exploring physical therapy, which ended up fitting in really, really well with my passion for wellness and health and just taking care of the body and finding the best ways to do that, which really is how I came up with the name Essential Therapies, because over 30 years now, more like 35 years of just having a passion for fitness and wellness, nutrition, movement, mindset, all of these things have come together. It's never one thing. So, when I was really focused on nutrition, let's say, or focused on exercise. And I think that's what we have a tendency to do because we put all of our focus here in one area, but it's never one thing. It's all of these things together. So that's how I ended up with, this idea of essential therapies. But as that morphed when I was in physical therapy school, I was introduced to myofascial release, and the creator of myofascial release, the way that I know it, is John Barnes. And I saw a video of him introducing what myofascial release was, which was presented by one of our instructors. And she was not a myofascial therapist, but she knew it was important for us to learn. And there was something about it when I saw that on the screen and I saw him talking about it, it really resonated. So from there, now fast forward many years, I am now focusing, and have been for my whole PT career, really. I realized that myofascial release was really the missing link, and that everything is connected through the fascia. And just like so many other things in walks of life, especially medicine and wellness, we get focused on one area, like I was saying. The trouble is it's all connected through this myofascial network, which has been completely ignored. And that's what has really helped. I didn't plan it initially that way, but when everybody was getting better with this fascial treatment, then I really ended up focusing a lot there. However, all these other little pieces are important, part of the puzzle, and it helps everything. So,
interesting. Yeah, that's fascinating. Yeah, I know we went over a lot of that. Dr. Cindy gave me a sort of a introductory treatment, a couple weeks ago, and it was really interesting. And as you were, doing the treatment, you explained how all that is sort of fits together. And as you adjust one part, you can feel something in, you adjust your leg, you can feel it in your neck, or, whatever it might be. It was very interesting. And so when you say it's all connected, yeah, I saw that firsthand.
You felt it.
I felt it. Exactly. I did.
Right.
I actually felt that. And I thought, wow, I've never seen anything like this before, because for most of us, we're not really exposed to the stuff that you do. It's more of, okay, let's look at, a recreational massage, or a therapeutic massage, a more traditional type of therapeutic massage. So it's very, very interesting to me, as somebody who was outside of that world, to see how that benefits. So what you said is exactly right. It's just, the whole body, it's all interconnected.
It's a good point. And the other thing is I did for quite some time spend part of my career in traditional physical therapy, outpatient. I worked in acute care initially, and then outpatient physical therapy. And so I'm familiar with that world, but I always had this awareness of the fascia and tried to incorporate it as much as possible. But for the most part, it's not recognized because it's invisible on all of the testing that we do, MRI, X-ray, CT, and so on. So, but we can feel it. We can learn to feel it in our own bodies and as practitioners. And there's definitely a very specific way of explaining that and feeling that, which is part of what all of these series will be about, putting in the pieces.
Yes, exactly. And I'm really excited for this series, because I think it's really going to educate a lot of people on how the process works and how it can help people. It's a whole other, way to treat a lot of different types of things that we've talked about a little bit. And I know you've only scratched the surface explaining it to me in our prior conversations, but I'm excited to just learn more about it and how it can help other people, and just really educate people on, what this is and what you do and how you do that, and all of these different types of things. So yeah, it's going to be really fun.
Yeah. And the fun thing is, I love learning. I always have. I've been, teased my whole life for being taking so much school and whatever, but there's always something to learn. I'm still learning doing this work. It's, every day. And this experience that we're going to talk about here in a minute has also taught me a lot, and taught me that there is so much more to share.
Yeah.
So yeah, I love it.
Well, that's a good segue. What happened? Let's talk about this.
Okay.
And for those of you who are not watching this on the YouTube channel, yes, Cindy was in an accident, to say the least.
Looks pretty good on this camera.
It actually doesn't look nearly as bad as you had initially described.
No.
I will say that for sure, especially considering you were life flighted. Which you're going to go over in a second, but it's the craziest story. So take it away. Tell us all about it and how it all relates into what you do.
Okay. So super excited to get back into our group rides on Wednesday night. There's a large group of cyclists that get out, and these are a lot of people who do triathlons, which I've played around with that a little bit. Nothing spectacular, but I love triathlon. And so I haven't been out on my bike. I think I went once on my triathlon bike this year, and then planning. And I did kind of throw stuff together. On Wednesday, there was kind of this debate. I needed to do something with my kids. I kind of thought about, well, maybe we should go to Target instead of this. I really wanted to go on this ride. It was meant to happen. So take off. It's a beautiful night, and there's all these different groups. There's like faster groups and slower groups. We picked the group. We're headed out. It's gorgeous. But as in any group ride, stuff happens,
Sure.
Anytime you go out, whether in a car or whatever, right? You never know what can happen. So there was a moment where there was a yellow light, and there was no cars around or anything. And I was like the third person in this group of maybe 12. And there was like some hesitation. I'm thinking, are we going? Are we not going? And then, my calculations weren't perfect, of course. And let's just say that I wasn't able to swerve in the nick of time to avoid someone else. And I ended up face first into the concrete on Bancroft Road. So
Whoa.
yeah. And when something like that happens, it's kind of like, often you have that slow motion moment. You know what I mean?
Yes, I do.
Only this went so fast. I didn't even have that slow motion moment. Like I saw things happening and I thought, oh,
Yeah.
and the next thing I remember, I felt the hit and then I was on the ground going like trying to breathe and I could not breathe.
Wow.
So, and I
Jeez.
knew it was bad because I could feel my face. I was aware of it, I should say, but mainly I couldn't breathe and I couldn't get air in or out. And there's this kind of moment where then time slows down,
Mm-hmm.
and I'm trying. And it's funny because your brain is thinking, well, what if I try? And I thought I might have. It seems like I even tried to crush my own chest, like to try and get the air, get some movement. I could tell that there was like a seize. And I thought to myself, well, if I don't breathe pretty soon, I'm going to pass out. But then I had this little bit of air came in and then this big noise. Like what often happens is after you have a
Yeah.
compression of air like that, then there's this,
Right.
So I started to breathe and I realized what was going on here. And I could feel in my mouth with my tongue that my teeth were really messed up. And I mean,
Wow.
I could feel like if this is my right front tooth and this is my left front tooth, which were, together,
Yeah.
the right one was inside,
Oh my gosh.
almost directly behind the left tooth and kind of on an angle. And my whole side of my face, I could feel, and my jaw, I knew was off. So the jaw is the only bilateral joint in the body.
Okay.
And if one side is affected, the other side is affected. And I could feel the jaw was seriously off. And with this work, with myofascial release, we have what's called, and John Barnes started this idea 50 years ago when he started teaching this stuff, is imagine like watching a TV on there's channel 5 and channel 3. On channel 5, we have the intellectual channel. It's where we're thinking and we're processing in our brain. Okay? It's like a left brain scenario.
Yep.
Channel 3 is the opposite, right brain, more intuitive, more of being present, kind of, I think of it as connecting with the heart and being within our body. That's where authentic healing happens. That's where we want to be as a therapist. When we're connecting into the body, we want our patients to be there. It helps us to be within, because the body, I believe, is designed to heal itself as much as possible. Sure. It's an incredible machine.
Yeah.
And so I knew immediately from my practice of being in channel 3 as much as possible that I needed to treat my head right then. Like, I'm like, okay. And I didn't freak out. I just kind of went into this space of, okay, my maxilla bone is totally compressed and I need to remind it where it needs to go.
Wow.
So there's many cranial techniques that we use in this work. And I immediately put my hands in my mouth and kind of held my head. And I kind of wonder what the people around me were thinking.
Well,
because
I'm just thinking, how did you remember to do that?
I don't know.
I mean, you're laying on the ground. This had just happened. And you're like, well, I should probably adjust my face now.
Well, and it's funny because some people have said that, like the fact that you could be so present, but I guess that's the goal. And maybe, I'm so glad that it wasn't even a thought. Like it's so part of me now from many, many years of practice that I knew what to do, and I believe anybody can learn how to get there. Truly, if they have the tools and
that's just
and
fascinating.
the know-how.
Yeah.
So I just kept working. And meanwhile, I'm hearing everything that's going on. I'm hearing there were some nurses there, they're doing their thing. I can hear them calling 911 and I'm just like, it's okay. Like I was in my head, man. I could feel everything between my hands and through my skull and down into my body because everything is connected. And then even until the ambulance got there, I'm still working. I did walk. I kind of remember walking over to the edge so we could get out of the middle of the road. And then they took me to the kind of outlying ER hospital. And while I was there, and this is kind of where everything went crazy, I thought it was, I was working this the whole time. It was still really off. And I'm in there talking to the doctor and the intake, and they give me some meds. And a little bit, I started getting dizzy. And I told her, like, I'm feeling dizzy, And she's like, next thing I know, I had gone out, and then they're all like trying to talk me back, and I'm like, kind of thinking, well, I don't really want to come back. I'm feeling really good right now. And I had a seizure.
Oh no.
So I heard her say, well, you didn't just pass out, you had a seizure. Apparently I had gone into this kind of, extended position, and I don't really know everything else. So I'm like, okay.
Huh.
Right before that, however, a pretty major thing happened, and I'm working on my head this whole time, and I'm getting close. I can feel this tooth. I told you it was way off, right?
Yeah, yeah.
And all of a sudden, kerplunk, like that significant. I felt it, I heard it, and my
It,
tooth was next to the other one.
it just popped back?
Just popped
Just
back.
came right back.
Yeah. And not just the
Wow.
tooth, mind you. So the tooth, the root, goes
Yeah.
deep, and it's connected into the facial bones and all this. So the bone that's right here, the maxilla bone, there's two of them.
Mm-hmm.
And the line down the roof of your mouth, some people have a ridge there where you can really feel that line. Others, it should just be very smooth.
Okay.
That had been off when I was working on it. And so that whole bone is what shifted it, not just the tooth, right? So it's the tooth next to it, the tooth next to that, and so on. That whole cranial bone, because I had been working on it all that time and softening and softening and softening, it moved back.
Wow.
And it had been kind of working that way, but it was that moment that really,
Sure.
kind of did it in. Now, I found out later that what they had given me was some pain meds, some fentanyl, actually. They put that in there. And so I almost wonder if that helped me kind of soften a little bit more and try to get that. I don't know, like, who knows?
Yeah.
Or maybe was I having a reaction? There's all these hypotheses, right? Doesn't
Right.
matter. The thing is that when that happened, it was so profound. I actually screamed because it hurt for a moment.
Yeah.
I spooked the nurse near me. She thought she pulled my hair or something. Like, no, I didn't even bother trying to explain it. But I was so relieved because there was a relief of tension there.
Yeah.
And what the fascia does, it's such a living, communicating tissue. It's to protect us, right? So we have a trauma. It's gonna compress. It might tighten. It might help to block off blood or nerve flow so we don't bleed too much or we don't feel pain. All these different things that it can do. The trouble is it might get stuck that way.
Okay. Sure.
And then we're carrying that trauma for who knows how long. And not only is it just kind of this fascia we're talking about that, sounds a little elusive. What does it look like? What does it feel like? Which we do have living pictures of that now. But it's the energy that's stuck in there. So we are energetic beings, a lot of times people don't like to hear, we're talking this woo-woo stuff. It's not woo-woo anymore. Like, I mean, if you think about it, what's a battery?
Right.
The battery has energy in it. It has a positive and a negative pole. Every cell in our body has positive and negative charges, So this is nothing, out there. This is real stuff. We get energy can be stored from an event in our body, that impact in the ground, it throws off our energetic system. Okay. So what I was doing at that moment is learning, because I have this experience of learning how to dissipate and to connect. I was already letting some of that stuck energy go. And as I was treating, I was doing the same more directly at the fascial system. And then when that shifted, that energy came out. And I've been treating myself even 2 or 3 times already today. I've treated myself and I could feel heat release and softening and everything. Wow. Something that's ongoing until I know that I feel like I've got things back. But that was pretty profound. So then they sent me, they did all the testing, then everything starts rambling when you have a seizure, like, look out. It's kind of like, having chest pain and they send you for all the things. But so then they called Life Flight.
Okay. That was
to get me to St. V's.
Okay.
After that seizure happened, like, you've got stuff going on. We got to make sure we need an MRI because you may have a small bleed in your brain. I mean, I hit pretty hard, obviously.
Yeah, you did. Yeah.
So that started the whole, episode to St. V's, which was cool because the history with St. V's is right out of PT school. I took a job. I just thought it was so cool. I had an internship there in acute care, and I worked there for a couple of years while I was finishing my PhD, and I loved it because I saw people come in off of Life Flight, and they needed PT evaluation within the first 24 hours to see, what they could and couldn't do and all of that. And so here I was experiencing this crazy already relief from this trauma that I had where, who would know to do that? Like, we
No,
just don't acknowledge that in our
No.
medical system.
No, I've never even heard of that.
Right. And so I even try, like, I'm thinking to myself as I'm watching this whole intake process, how do I explain? I want to say something to these doctors and these people here, like, what happened? Like, you don't understand. Like, this was all smashed and I was a wreck.
Yeah.
And it's better already, you know?
Yeah,
and
they would probably think, you've,
yeah,
like, nah, I don't know about this.
you had a seizure. That's
Yeah.
you don't know what you're talking about. But there was profound healing already.
Yeah.
And what our system is set up to do is it's important, if I had a brain bleed, it'd be a different scenario.
Sure.
If I had a broken bone, it'd be a different scenario. But somehow I avoided any broken bones. Go figure. There wasn't, extreme bleeding, even though I hit so hard in my head. My teeth were on the ground. Like, all of these things are really kind of shocking to me. But when we go to the ER and we get all this testing and they're looking at all of these things, they're never going to see fascia in that stuff. All of the work that they did on me, I'm not looking forward to that bill, right? But none of that saw the fascial system.
No.
So then I ended up with this heart monitor.
Yes, you're all hooked up to it. For listener, if you're listening, she's got some heart monitor, the electrodes on,
the 48 monitor on, which throwback in my mid 20s, they threw this on me too, because when I was in exercise physiology lab, we were doing EKGs, going through the whole thing. And I was throwing PVCs, they call it, which is the preventricular contraction of the heart. It's like totally not normal. Like, usually it's showing there's some heart issues. And I was super fit back then, big runner and cyclist and all the things. And I had a really fit heart. Right. So my heart rate was very slow. And the way the heart is, there's nodes in the heart that basically tell it to beat, okay, to put it simply. And when you have a very fit, low heart rate, those nodes are like, wait, what's wrong? We're used to like 80 beats a minute, 70 or 80, but you're too fit. Like, it wants to do something. And so it can show some weird things on the electrical analysis of the heart. So when I was there yesterday, or when I, was admitted and they're looking at my heart rate, it's so low. Well, it's just, my heart is just thankfully a fit heart, and so they're not used to seeing that. But with what happened, and I had low blood pressure too, they're thinking it could be all these things, and it could have been. I mean, I was, luckily I cleared out from all of those things. And they said, well, we want you to have this. And have you ever had these problems? Well, the truth is, yes. And, in my 20s, I had to wear this, and I actually had what was called a slight murmur in my heart at the time, and a slight mitral valve prolapse. So here's an interesting thing. I had that for a few years, and I don't remember, it's so long ago now, I don't remember why we decided to test it again. But turns out, and this is why the body is so amazing. It can do incredible things. And in our system, we just assume, okay, this is what we saw. This is what we saw in this testing. This is how you're always going to be forever. And when you have a mitral valve prolapse, they want you to take antibiotics before you get dental treatment. There's all these things. And we did the test again years later, and I didn't have it anymore.
Wow.
So my mitral valve totally resolved, and so did this regurgitation, which is the prolapse, right? Yeah. Completely resolved. I had all the testing again, and it was fine. They didn't know what to do with that, but that's okay.
Yeah, they probably won't.
Yeah. So here I am again with this monitor till tomorrow afternoon. Wow. And but they did great. I mean, St. V's was amazing. They did what they do for emergency medicine. I mean, this is what we know right now, and it's obviously saved so many lives, and it's important. But there's a missing piece. Yeah. And I truly believe the missing piece is learning how to connect to this channel 3. Yeah. Our inner self. We have been taught from the time we were sent off to preschool or grade school to not feel what's going on inside here, and to only go by this. Sure. And we have missed a ton. Yeah. And a lot of it results in injuries that are of a level that we don't even know how to label, because that's what we do. Everything in our world is channel 5, you know, and it's important for a lot of things. It's not that we don't want channel 5, but we've gotten so far away from channel 3 and feeling and our intuitive side that we have lost that ability to heal. So had I been totally in channel 5 after that accident, I would not be sitting here today. I'm
No, probably
certain of
not.
it.
No. And your jaw would be, your teeth
And
would
my
be,
teeth would be a
oh my
mess.
gosh.
They'd
Can you
be
imagine?
they would be doing more
Oh,
invasive treatment. And
yes.
think of this. So the fascia goes through every cell. The cranial bones are all a mess. There's some very important things in the middle of your head. We have that, not just the brain, but the cerebellum, which basically tells us how to do everything movement wise. I mean, there's so many things. There's the pituitary gland, the hypothalamus, the pineal gland, like all of these things are not going to work right if they're compressed.
Mm-hmm.
If you're standing on the garden hose, the water's not going to come out the other end.
Sure.
You take your foot off that garden hose, then we have flow again.
Right.
What I was doing in my mouth on the ground on Bancroft Street was removing the foot on the garden hose.
Okay. Okay.
And learning how to connect into that and move and feel it. And I believe that people can be taught how to do some of this to their own body.
Yeah.
And I've been doing a lot of my own self-treatment for many years, because when I first started doing this work, there was no one around here to work on me, and I needed it badly, which,
Okay.
in subsequent shows, we'll talk about some of that. But,
Yeah.
I learned then how to take the feeling of this myofascial release and create it with different self-treatment techniques, some of which were taught by the John Barnes method, others I created myself.
Yeah.
And at the time, I was also going through yoga instructor training. This was, before it was on every corner, where I went away for 15 days, day and night. It was, learning about yoga, and then also being an exercise physiologist and teaching fitness classes for 17 years and all of the things, and putting that together and creating this. But so I'm just thrilled that it worked, and then and so I was able to go home feeling this good, and being able to be here today is kind of mind blowing.
Yeah, I mean, no. And as I sit here talking to you, I mean, if I didn't see you, I would never know that you had been in any sort of accident. I mean, you know what I mean? I mean, it's just completely normal, I mean, and you don't even look that bad, honestly. I mean, really, truly. It's amazing to me that you went through that. To say you were life flighted 2 days ago it's just almost mind blowing, so.
The other side of this is that some additional training that I've done over many years, besides the Channel 3 stuff, and in the last year, I have been involved in this Peter Sage Elite Mentorship Forum training, which I'm going to be a trainer for here shortly, and I'll be able to offer some of this through Essential Therapies as well. But we focus a lot on what brought me to this program is, for many years I've just been a seeker. I've all kinds of self-help books. I've been, teased about that as well from a lot of people. Oh, you want to look at self-help books? Clearly I was searching, but there's always something to learn. And so when I came upon, things that really made a difference for me, I wanted to share it with other people.
Sure.
And one of the things that I did, even when I had my first clinic here in Toledo over 20 years ago, we would do these little workshops, and we called it back then creative visualization. And it was about imagining and then kind of feeling that as being what you want your life to be. And that was creating it. So, with the Peter Sage program, we used a lot of these different things, and realizing that we live in a world where we are not utilizing our ability to create as humans. We are very energetic beings. And so to put that in maybe an easier mindset for people who don't know where I'm coming from with this, is it's about mindset.
Yeah.
Right. It's
sure.
the creating mindset. And this is something that athletes have done for decades. They imagine making things happen.
I think they call it visualization. Is that another word for it? Same
visualization,
thing?
Yep. So like I called it creative visualization when I was doing these workshops back at my old studio. And yes, that you may also hear a law of attraction is another term that people use. So all of these things I was searching for. And when I came upon and not just searching, but getting answers through John Barnes, myofascial release was one way, and just all of the things that I would be drawn to. And so Peter kind of puts this all together in a very intensive 6-month long program where you have a peer group and you have buddies and you meet multiple times, several hours a week, that you're putting towards, learning. It's intensive learning and utilizing these skills. And it's about changing our mindset and
Mm.
how we think about everything. Because it's really most of our reality starts with mindset. And the cool
Sure.
thing is, this started back with John Barnes when I had an intensive treatment. When I first saw the reality of this, I'll tell this little story because it kind of goes in with all of
Yeah,
this as
please.
well. I was living with severe migraine headaches. And I mean, I was taking Maxalt and Imitrex most days of the month. People might be familiar with those drug names. It was
Mm.
the only thing that was getting me,
Yep.
by. And I was running a clinic at that time. I was very busy. But it was rough. And then I've been doing myofascial release work, but then I actually went and to a seminar by John and realized this is what's going to help my migraine headaches. So I scheduled for more courses and an intensive with him and his therapist in Sedona.
Mhm.
And during that week, and it was in the month of February, and about 21 years ago now, wow. Um, I had been a triathlete, but for about 18 months, I hadn't been able to really train or even do exercise much
Mhm.
other than basic walking because I was in such pain and my whole body was
Wow.
feeling it. I was a mess everywhere, really. And
This from the migraines?
from it, well, the migraine, I mean,
That was sort
it's,
of a part of it?
yeah, it's all
Okay.
part of it,
Okay.
right? It's all part of what was first, right? The whole
Right.
chicken and the egg thing.
Right, right.
So one of the things that John said to me, I can just be, so clearly I can see it. He asked me, "What is it you want to be able to do?" I was like, nobody ever said that to me
Yeah.
exactly like that. What do I want to be able to do? And I realized, if I was able to do triathlons again, just even the short ones, I knew if I could do that, then I'd be able to do all the other things I wanted to do, right? Because
Sure.
that kind of summed everything up. If I could do those 3 activities, and I love that activity, like just being with the group,
Right.
helping people doing it for the first time and seeing people, experience a goal that they thought they could never do, and here they're doing it. It's
Yeah.
just really fun for me. And that's what I told him. I said, "Well,
Hmm.
I'd love to be able to do triathlon again." And he says, "Okay, what I want you to do is to imagine doing triathlon
Hmm.
as best as you can. Use as many senses as you can in your imagination. Do it frequently every day,
Hmm.
even if it's only 30 seconds. Imagine yourself doing the activity with joy
Hmm.
as if you're already doing it, and then it feels great. And just
Yeah.
do it often." And that was all he said to me.
Wow.
And I took it to heart and I started doing that. And that was February. And in June, I did my next triathlon. Isn't
Wow.
that crazy?
That's crazy.
So,
Wow.
but this is not anything new or
Mhm.
unique. Like
Right.
you'll start to hear more about it. So, fast forward, you may have heard of Joe Dispenza.
Okay.
Dr. Joe Dispenza, he wrote a book a few years back now, probably 6 years or so ago, called The Placebo Effect.
Yes, I have heard of that.
Okay.
Yep.
So a lot of people have heard of that. I bring that one up because that is a common one and people know what a placebo is, right? So he was a triathlete also and was in a horrible accident. Turns out he healed his spine, which needed, 4 doctors told him he needed rods to fix this.
Wow.
And he ended up basically healing his spine through mindset and connection, and then
Hmm.
he spent the next 30 years studying how in the world did that happen.
Yeah.
So all of these things are building off of the same system that we are very powerful in our mindset. So John started me with that over 20 years ago, and I've seen the power of it. I've seen the power with patients. I
Mhm.
try to encourage and empower people to be very aware of their mindset
Yeah.
because it will stop you
Oh, yeah.
just as well as it can, make you successful. And so when I was on the concrete the other night, that's where I was. I'm like, I saw my head. I felt the
Hmm.
joy already of that tooth popping back,
Yeah.
right? When I started that process, I didn't allow myself to feel fear
Huh.
or worry or freak out. I just was present in that moment with my head and my body and my spirit. And I just was able to stay there.
That's amazing. So you actually like visualized, like the tooth going back to where it needed to be and,
Hmm.
everything sort of being,
Hmm.
back to normal, so to speak.
Hmm. I
Wow.
did.
That's
I
amazing.
was I was feeling I was feeling it off, but I was just aware of it. I'm like, okay, this is where it is. But and I would feel a sense of peace, knowing and feeling in my mind that everything was where it should be.
Wow, that's
Yeah.
unbelievable.
Yeah.
Yeah. But you're right. Yeah. If you can teach people this or, show people, how to apply this to so many different parts of their life. I mean, I feel like I've seen that just, out in the world, just a lot of lately, a lot of different things where they're saying the mind body connection. There's a
Absolutely.
lot of things that, a lot of research is being done to look at that. And I've always heard of athletes, especially using, visualization. And
Hmm.
now it's sort of spilling
Hmm.
over to, other professional areas, corporate life and things like that. And, visualizing what you want, visualizing where you want to be, whether it be, with work or whether it be with your family or whether it be with, with whatever you're doing, you
Hmm.
visualize that goal.
Hmm.
And, but it's, so it makes perfect sense that you can do that with your body
Well, isn't
physically,
that like the most important one to start with?
I would
Like,
think,
I
yeah.
mean,
I mean, but
exactly.
I just don't think it's been, at least I've never seen it been discussed like that with healing,
Hmm.
right? It's more, it's all usually more mental.
Hmm.
How do I do this? How do I visualize getting this new promotion? How do I visualize, getting, this person to like me or, whatever it
Right.
might be. But yeah, when you apply it to the physical side of your body, it makes perfect sense, but it's just not, like you said, it's just not real common yet.
Right.
And this podcast, I think, is going to really help people to understand that.
Well, that's my
How do
hope.
you
Yeah.
execute
Hmm.
that? It needs to be discussed because it works.
It does. And, I was aware of this when I was working in the medical system, but it was something you couldn't talk about.
Yeah, it
You
was
didn't talk.
taboo. Yeah.
Yeah, you didn't talk about that kind of stuff. And that
Hmm.
that was my inspiration for even starting my own clinic in the first place years ago, was that, I'm talking about all this left brain stuff, but there's so much more that this is about.
Yeah.
And it's the most important thing is to start here. But again, I think it's because, like you said, we're aware of all these other things, the sport, the business, the things that are in our external world,
Hmm.
because we were pulled out of that internal world at a very young age,
Yes. Yeah.
and it's trying to get back to that space. And Bruce Lipton will talk about this a lot. He's another one of my, great teachers I love to read and listen to. It's through age 7 where we're kind of programmed on
Hmm.
autopilot. So when
Hmm.
we're learning the most important time of our life, we're creating our subconscious mind. That's the other piece of it. Our 95% of what we do, we run through it's subconscious.
Hmm.
If we want to make a change, like even just talking about this, like, okay, we want to, become more centered and learn this whole thing we're talking about. Well, it's not natural and subconscious to do that. We
Right.
have to make a plan
Hmm.
and make it a conscious effort to make a change, right? That's what
Sure.
makes change so difficult. Why do people have a
Right.
hard time getting, starting any new thing, is
Sure.
that we have to pull out of our patterns.
Right.
But
Change
it's,
habits. And that's
yeah,
hard to do.
it
Yeah.
is.
That's hard
That's,
to, it's hard for, I think, a lot of people to get out of their comfort zone with whatever it is they're doing,
mhm,
whether it doesn't matter what it is, even medical, I've
mhm,
always seen it be this way, this is the way it's always been. So this is the way that it is. And when you're,
exactly.
yeah. And I think you're trying to show people how to get out of that and say, no, it's okay to look beyond that.
Mhm,
It's okay to go a little bit outside of that and at least explore something. And, once they try it, I think they're going to see, oh, hey, she's right.
mhm.
This works.
Yeah. And
Yeah.
I think that's what became so apparent to me in the last less than 48 hours, really, is that just the significance, the
Mhm.
importance of getting this out there
Yeah. Well, again,
and
you
in
lived
our
it.
world. Yeah.
Yeah. I
And
mean, it's unbelievable. It's just,
in the medical field where we are right now, I mean, everybody talks about it. It's not working. We're
sure.
doing something wrong. And it's because we haven't acknowledged the system.
Hmm.
And, John Barnes has always said that myofascial release is going to be the healthcare of the future.
Oh, wow.
And, just my experience these last couple of days. Yeah. I mean, I believe that. And,
Hmm.
and it was only, sadly for me in a way, I mean, this was trauma. So it was kind of more profound. It was more in my face, literally. And, all of everything around it. But we talked about the life flight situation that, I told you I had a previous experience with life flight. So I'm just going to bring that up. I had another experience, again, the body. This is the body. My oldest child is 16 now, but he's my with my first pregnancy. I had placenta previa, which is a condition where the placenta is over the cervix, and um, I had dealt with infertility for 3 years, and so there was just a lot of emotion around this whole situation. And
Sure.
he was IVF, so
Jeez.
there was just a lot
Yeah,
going
a
on.
lot. Yeah.
And so in the situation that I found myself in with this placenta previa, I ended up, and maybe that would be a whole podcast in itself, because there are a lot of women who have to deal with bed rest during pregnancy. I was in the hospital for just under 3 months on
Whoa,
complete bed rest.
3 months.
And
Wow.
in California, away from all family and friends, because we had just moved out there. And so talk about not having your support with you. And this is, 17 years ago, people weren't doing stuff on the phones like they are today.
No, no.
I mean, I was the one, I was texting, but other people weren't. And we had to use, email sort of, and
Hmm.
the signal wasn't great in the hospital because they didn't have that kind of thing. And so it was very different
Sure.
then than it would
Yeah.
be today. But I learned how to be in channel 3
Mm.
through that situation. I already had experience with this, but being in that situation with him, I created it just like I created the scenario years before about doing the triathlon again.
Hmm.
So when John said, "Imagine what it is you want," what I wanted was my baby to be healthy and to stay in my belly as long as possible, because, one day in utero is like 3 days in the NICU. And, the growth and healing would be so much better for him.
Sure.
And I truly believe that my ability to stay present and, really focus and visualize. And again, here we're talking about mindset, right? It's like the placebo effect. It's all kind of the same system. And my doctors out there, now I was very fortunate to be in one of the best women's hospitals, Sharp Mary Birch in San Diego. And I had 6 amazing physicians, and everybody was like, you're not going to, I knew from studying all of this that I wanted him to be in there for 36 weeks, 36 weeks, and everybody's like, 32, this is what can happen to 20. I mean, I was like 20 something when I went in there. And, my goal was I wanted him to be in there 36 weeks. And I just kept visualizing that was going to happen. He was going to be fine. He wasn't going to need the NICU. Nobody believed me.
Hmm.
I just kept that to myself, and they all expected that I wouldn't be able to stay there. Plus, everybody I knew was like, "Oh my gosh, of all the people that I know, I can't imagine you being on bed rest in the hospital for that long." Nobody
Right.
thought I could do it. And I mean, part of it is I love a challenge too, maybe, but we did it,
Yeah.
So, and
Amazing.
it was because I was able to center
Yeah.
and use that mindset.
Wow.
It's just, I don't think we've even begun to tap into it, but there's tons of research out there about it, and we'll be
Yeah.
bringing it to light.
Yeah.
So
That'll be another fun episode to talk about bringing
yeah.
that out and just
Mhm.
the techniques I'm sure that you have to do that. And
Well, speaking of the techniques, I mean, what I'm doing now and what I've decided to take this experience and this trauma that I'm really still dealing with, because I am sore. I'm
Sure.
concerned about my
Sure.
my teeth, and there's some things that are kind of significant going on, but I'm visualizing the outcome that I want, and feeling that and the joy of that already. But what I'm doing is sharing my self-treatment
Yeah.
and explain to people what it is that I'm doing and all of the essential therapies that I'm putting together,
Yeah.
even from the essential oils like I brought in here today, make sure, there are oils that I'm using that are very specific. There's nutritional products that I'm using to help my body,
Sure.
the mindset that I'm using, and the myofascial self-treatment, the cranial work that I'm doing, and adding this in my life and making it part of a lifestyle so that I can have the best outcome possible with
For sure.
this, and teaching people what that is, so
Yeah.
that they can learn how to be in their bodies and make the best of that.
Yeah, no, I think it's really important. And it's, I think, like I said, it might be, a good thing to a certain extent that it happened, just because you can use use your experience to literally show people, hey, this is working. This is how it works,
Right.
So it's amazing.
Well, and it comes right down to being grateful,
Yes.
actually. I
Yeah.
mean, that was also when I was there on the ground. I mean, I was constantly thinking, what what I was grateful for. I mean, first of all, I was first grateful for that breath that came. And then the fact that my hands, okay, my arms or my hands are okay. I can put my hands in my mouth,
Mm-hmm.
you know, it could have been, I could have dislocated my shoulder. I mean, there are a billion
Sure.
things that could have happened.
Fractured your hands so that you
Right.
couldn't do that, Sure. Yeah.
And there's so much out there too, even now still already about gratitude and how
Mm-hmm.
important gratitude is.
Oh, yeah.
And what, to bring the energy world back into it again, this is also about frequency. So our body is run a frequency, everything has a frequency to it.
Mm-hmm.
So we can measure these things, but just to put it simply for now, gratitude has a much higher frequency than feeling fearful or
Wow.
hopeless. Okay.
Interesting.
Can I just saying those words, doesn't that feel different to you?
Yeah, it
Like
does.
if you can be grateful for what you do have and the positive side of whatever situation it is, then that elevates your frequency and
Mm-hmm.
it makes everything better. It makes healing happen better, all of the things. So
Mm-hmm.
that's been something I've had to really learn. I didn't grow up in a situation like that,
Mm-hmm.
I don't think most people do.
No, I don't think so.
We look at like, oh, this thing happened, that, I mean, we're focused on the negative
Yes.
all the time.
Yes.
And if we can shift that, but see, when it's stuck in our subconscious mind,
Mm-hmm.
because we had it growing up, it's really hard to shift. So it takes conscious effort to do it.
Yeah. And I think it's important, especially in today's world with all of the mental health, headlines that are out there. And I mean, just all the terrible things that are happening in the world, a lot of it does go back to mental health. And,
Mhm.
and if a lot of those people could just sort of figure out how to self-treat themselves, if they don't have access to good, mental health care, or, for whatever reason, they're not getting that, if they at least could be educated, or at least, hear something about, hey, this is a way to help myself.
Mhm.
I think that would, that could help a lot of people,
It's huge.
curb some of these issues that we're having in society in general.
Yeah,
Yeah.
even just, of course, that brings up for me cold exposure, which is something that I started a year ago. I don't know if we talked about that.
I don't think so. Not cold
oh,
exposure. No, that's probably a whole other topic.
It is, but it also helped me
Yeah.
quite a bit the last couple of days because multiple times I thought to myself, okay, this is what cold feels like. And I'll just give you a little quick tidbit on that. Like last March, a year ago, I started practicing deliberate cold exposure, getting in my pond when it was very cold. And this winter it was, in the mid 30s.
Yeah.
I'm breaking the ice out there and going and getting in that pond for
Wow.
2 to 5 minutes, and
Wow.
based on research and all the things. And there's a whole story behind that. But here's the bottom line is, talk about helping mental health.
Yeah.
Wow. Like,
Huh.
unbelievable to me. And
Huh.
I know for certain that was the thing that did it, because I hadn't changed anything else. And when I stopped for a while in the fall because of circumstances, I really could feel the heaviness of, the whole mental health piece being much more difficult. And then when I first started feeling improvement with that, when I first started doing this over a year ago, I started to then research, I wonder if this is helping mental health, And so oh my gosh, there's a ton of stuff out there.
Yeah.
About it. So
really interesting. Yeah. I've heard a lot of, and sometimes I'll even do this, but I've heard a lot of people say, take a cold shower,
Right.
if you can, or at least take a normal shower. And then for the last, 30 seconds or whatever it might be, then it's a cold shower. And then right before you get out, and then it sort of energizes you and kind of gets you ready for the day. I've tried that a few times myself, and I'll admit you do feel very refreshed, and it's in a weird way, you feel like super positive and like you can just take on the world, and it's just that shock to your system, but yeah, that totally makes sense. I'm not sure I'll get in a pond for 5 minutes like you did in the middle of winter, but
you'd be surprised.
Yeah, I can imagine, but I mean, it makes sense. Yeah.
Well, there's a ton of biochemistry reasons why that happens,
Yeah.
so that's a big discussion. But yeah, you really were feeling something,
Yeah, for
and
sure.
it does make a difference. And then when we create a practice of something,
Yeah.
it's different set of things that happen as our body adapts. Because that's the cool thing that I like to really get across to people, is the body adapts to whatever it is we do. Okay.
Mhm.
If you sit, like I used to be an accountant, and I'd sit for 12 hours during busy season in the tax season, and your body is going to adapt to that.
Sure.
It's not necessarily a good thing.
No.
You start exercising or even start adding water to your diet like you should, your body will adapt to that too.
For sure.
So we have an amazing machine that we're living in, but nobody gave us the owner's manual.
No. It's all just sort of starting, to kind of get out there. And I think this podcast is really going to help people to understand that, how it all works. How does the fascia relate to all of that? How can you, not just physically, but mentally improve your condition, whatever it might be. Even if you don't have a condition, quote unquote, how to just live a better life, through all of these different types of things. And that's what you're doing. And it's fascinating. It really is.
Well, it is the human condition after all.
There you go. The human condition. Right.
So, and there's, energetically, all of the things.
Right. Yeah. Right. No, that's fantastic. So, well, before we wrap up, what do you want to get out of this podcast? I mean, I know that seems a little obvious based on what we just said, but in your own words, I guess, what are you hoping to get out of this show just in general as we move forward?
What I'm hoping, I guess, is to get across to people some of the golden nuggets that I have experienced and found over the years that have really helped me. And I have experienced help other people or seen help other people if it wasn't something directly for me. I feel like there's a lot of information out there that even though you would think it's very available, and I fall into this trap where I take it for granted. Like we think people know this basic stuff, but they're not getting what I think is basic stuff. And so this is yet another avenue that will help bring awareness about. And then that's my big thing for myself is to be aware. If we're not aware of it, we can't do anything about it. So John Barnes has this saying, and I've loved it because it resonated with me instantly. Without awareness, there is no choice. And once we have awareness of something, then we can make a choice. Whether it's a preferred choice or not preferred choice, doesn't matter. We just have that ability then to make a choice. And if the more we know, knowledge is power. But if we know something and we're not doing something with that, then that's like not even knowing. So we need to increase awareness. So that's really what I want to do, is increase awareness so people can make their own choice. No judgment. I mean, do whatever it is you like. But if you don't know that it's available, then I feel like that's not a good thing,
Sure.
And so improving awareness so that people can make a good choice. And then also being really aware that, when you don't know what you don't know, which is one of my favorite sayings, people make fun of me, but when you don't know what you don't know, you can be really, you can be really at a disadvantage.
Yeah. And it's one of my favorite sayings is if you always do what you've always done, you'll always get what you've always got.
Right.
It's the same thing, but that's so true. Yeah. In fact, I just wrote down that quote from Barnes, without awareness, there is no choice. I love that.
Right.
That's actually, that is a really good, very, I think, profound quote because it's very, very true. Makes perfect sense.
So we will be increasing awareness one podcast at a time.
I like that. There you go. That's a great way to end it right there.
All right.
All right. Well, we'll see you next time on the Essential Therapies podcast with Dr. Cindy.
And hopefully this will be perfect. We'll see.
Just do some more, therapy on your face there. There you
always.
go.
Yep.
What a great episode. We hope you enjoyed that one. If you want more details about what she did immediately following the accident, feel free to send an email at cindy@esstherapy.com. Also, quick disclaimer, the name of Joe's book is actually You Are the Placebo. So we want to make sure that we reference the correct title. Maybe she hit that concrete a little harder than we thought. Until next time, thanks for listening and have a great week.